everybody. So this is a post kind of laser treatment, enucleation treatment for a potential verruca, potential fibrous corn. You know, you can't really tell what it is until you biopsy it. But when we did the procedure, we saw multiple little tiny lesions. So we dressed it up with a big dressing. So you can see from our dressing here, now loads of layers, paddings, all that kind of stuff. And this is what it looks like afterwards. So we're just going to spray some antiseptic just to loosen this up. And we've talked about kind of biomechanics, in terms of getting orthotics and wearing comfortable shoes. Excellent. Oh, it's healed really well. Yeah. You're exactly like the patient that I had on TV, actually.
Yeah.
That you...
I said I heal quickly. I heal quickly.
So what I'm going to do is, there's a little tiny wound there. I am just going to debride it, and then I will put another dressing on it. And then again, the medical shoe that you get will help. Spray a little bit. But looks brilliant. Okay. Really looks brilliant. How long has it been? It's just a week? Yeah, a week since. And you haven't been doing much. Fantastic. No. Excellent. Excellent. So when I debride it, I'm just going to clean the wound up. I'm just going to let you stay there. So it might bleed a little bit. It might be a little bit tender, okay? Just don't move too much. But I don't think you're going to experience the same pain that you had before. Look at that. Look at that. Brilliant, isn't it?
Okay now.
I'll show you. The wound is tiny. You need to look after this.
Honestly, I'm not even messing around. Yeah. I'm supposed to be starting a school on Monday.
Yeah.
But I might delay it.
Yeah.
Just to get it.
We'll show you the picture because the wound is...
Just to give it a bit more rest.
It's brilliant.
Yeah.
The question now is, will the lesion come back, right? Will your...
Yeah.
And how long this lasts? Because last time it lasted for how long? How long did it last for when you're...
I guess the other chiropodist, as I said, it didn't last too long.
Yeah.
It was back in no time.
Yeah.
But because, as I said, the pain was, excruciating.
Yeah. Will you use the smallest needle to do the anesthetic? Was that the worst part, the anesthetic?
Yeah, just the needle.
Yeah.
Just the needle. But I mean, once it was numb, it was...
Easy, wasn't it? Yeah.
Absolutely perfect.
Yeah. So we may have some kind of irregular tissue that looks warty like here on that side actually. So once it's healed, I'm gonna likely recommend some silver nitrate treatment.
Would you still recommend the insoles?
Yeah, I think long term they'll be useful just to deflect the pressure from that area.
Yeah.
Also, to reduce the trauma to the area.
Do you do that? Or?
We have a colleague that does it. Okay. I always refer because he's, mine more skin. So that's the wound there, really tiny. So we're just going to pad it up again. But yes, suspect that there may be some verruca tissue trying to return back. Okay, excellent. Need is iodine dressing. So we'll show you iodine, which is an antiseptic, or just any wound spray. Okay. A plaster. This is just a plaster, and the pad. Yeah. Because ultimately the pad will offload it. Yeah, and then let it heal a little bit more.
But as I said, any problems, I'm coming to see you.
Yeah. But like I said, you have no pain now. Before you were like 7. I remember it was quite high, the pain score.
As I said, because I'm on my feet all day at work.
Yeah.
Yeah, there's no kind of rest.
Yeah.
I'm active, so.
But I'm happy.
Oh, I am ecstatic, honestly. It's been too long.
So let me just take this up. So I've got to... Let me just check the location. Yeah. I think long term for you, padding is so important.
Yeah, I will get. No, honestly, I have to see about the insoles, but I will have to.
Yeah,
get about,
I think
I have to get about 3 pairs.
Yeah, if you aren't gonna get the insole, at least get the padding,
Yeah.
right? And then at least you've got some deflection, something that you can do yourself.
Okay, yeah.
And I would say, you know, for the next 2 to 3 months, I'm gonna also recommend you take some zinc supplements to boost the immunity. I think I'm happy with that. Yeah. Excellent. So that's how we pad it up. Wonderful.